Hi, my name is Deanna Harrison. This video is for Nursing 304 um, head to toe assessment. I'm going to go ahead and scan my room now. Okay, now we'll go ahead and get started with the assessment. Hi, my name is Deanna. I'll be your nurse for today. Can you please state your name and your date of birth?
Leon Hall, 1881.
Okay, and can you tell me why you're here today?
Checkup.
Okay, and do you know where you are?
Doctor's office / living room.
Okay. All right, so what we're going to do today is do a complete head to toe assessment. It's going to take about 30 minutes. Do you have any questions?
No.
Okay, and it's just to make sure that you haven't had any changes since your last visit. Are you allergic to anything you know of?
No.
Okay, and on a pain scale from 0 to 10, with 0 being the least and 10 being the greatest, can you rate your pain?
0.
Okay, so I'll go ahead and perform hand hygiene and start with the assessment. General appearance. Patient looks stated age. Facial features are facial features are symmetric. Skin is appropriate to ethnicity. No signs of acute distress or visible assisted devices noted. Patient height is appropriate for age. It's well nourished. Body and contour. If you can just go ahead and put your hands out like this. Okay. Contour is proportional from fingertip to fingertip. You can go ahead and put your hands down now. Body is relaxed position. Position is relaxed and body stature is erect. And no physical deformities are noted. Patient is alert and oriented ×4. Speech is clear and understandable. Patient is cooperative. Is dressed appropriately for the weather. No odor from patient. Okay, so now I'm going to go ahead and assess your skin. So, skin is warm and moist. There are no rashes or lesions, no wounds on the arms. Okay, I'm gonna go ahead and take a look at your hands. Capillary refill are less than 2 seconds. Bilaterally, I'm going to go ahead and check for your skin turgor. Skin turgor is present. Okay, and I'm going to go ahead and have you to put your hands together like this. Okay, the nail surface is flat and there are no clubbing noted. There's no clubbing noted. You can go ahead and put your hands down like this. And the lateral nail folds are round and smooth. Okay. Next, I'm going to go ahead and move on to your head. Is that okay? All right. So your head is normal cephalic. It is symmetric with the rest of your body. It's in midline. If it's okay, can I go ahead and palpate your head?
Yes.
Okay. So during palpation, I noticed no lumps, no masses, no tenderness noted. Okay. All right, so you can go ahead and lift up. I'm going to go ahead and have you rotate to the left, rotate to the right, and go ahead and look up and then down. Okay, range of motion of neck is intact. So now what I'm going to do is go ahead and have you to shrug your shoulders like this. I'm going to put my hands on your shoulders and you're going to feel some resistance. Don't let me push your shoulders down. Okay, great. All right, now I'm going to put you can put your shoulders down now. All right, and now I'm going to put my hand across your face and I want you to press against my hand. Okay, same thing on this side. Okay, great. So cranial nerve number 11 is intact. So now what I'm going to go ahead and do is I'm going to palpate your lymph nodes, okay? And you let me know if you feel any tenderness or any pain, okay? So preauricular, postauricular, occipital, jugular, digastric, submandibular, superior, posterior, submental, and if I can get you to shrug your shoulders one more time. All right, subclavicular. Okay, no masses or tenderness noted in your lymph nodes. Okay, and so now I'm going to have you to close your eyes. Okay, now I'm going to get you to smile. I'm going to get you to frown. Poke your cheeks out for me. Okay, now you can open. Cranial nerve number 7 is intact. So next I'm going to go ahead and go to your eyes. Your eyes, your ocular, your external ocular structure is symmetric. Okay, I don't see any infestations, no lesions or discharge from your eyes. I don't see anything from your eyebrows or eyelashes. I'm going to go ahead and pull your your eyelid down. Your conjunctiva is pink. Your sclera is white. And I don't, like I said, notice any discharge. So now what I'm going to do is I'm going to have you to cover up one eye. Okay, now I'm going to put something in your peripheral view. When you see it, say now.
Now.
Okay, great. So now I'm going to have you to switch eyes. I'm going to do it again on this side. Say now when you see it.
Now.
Okay, great. Cranial nerve number 2 is intact. So next, what I'm getting ready to do is I would just want you to follow my pen, okay? Okay, so cranial nerves number 3, 4, and 6 are intact. So next, I'm going to go ahead and look at your pupils. Okay. Oh, great. Okay. All right, so I'm just going to shine a light into your pupils there. Okay, and your pupils are round, they're equal, they're reactive to light, and if you can just follow my pen, and accommodated is noted bilaterally. All right, so next I am going to go and move to your ears. Your ears are symmetric. They line up with the crease of your eye. Okay, now I'm going to look to see if there's any drainage in your ear. No drainage there. And no drainage there. And I'm also going to check the back of your ears for any skin breakdown. All right, no skin breakdown noted. All right, and do you wear hearing aids?
No.
Okay, and how do you clean your ears?
Flush with water or Q-tip.
Okay, and are you around a lot of noise?
No.
Okay, good. All right, so next what I'm getting ready to do is I'm going to palpate your ears and you let me know if there's any pain associated there, okay? All right, so any pain there?
No.
All right, any pain in your tragus area right here?
No.
Okay, great. I also note that you have one piercing in each ear. Okay, so next what I'm going to do is what we call a whisper test. So I'm going to have you to cover up one ear for me. I'm going to say a 2-syllable word, and I want you to repeat that word.
Sunrise.
Okay, so go ahead and take your hand down. We're going to do the other side. So I want you to cover up your other ear. Okay, and
sunset.
okay, great. All right, so cranial nerve number 8 is intact. So next, what I'll have you do is I'll have you stand for me. And I'm gonna have you to close your eyes and have your hands out like this for me. All right, cranial nerve number 8 is intact. You can go ahead and have a seat for me. Open up your eyes and have a seat. All right, so the next thing I'm going to move to is your nose. Your nose is symmetric to the rest of your face. Okay, and I'm going to check to see if you have any drainage. I'm going to have you lift your head up just a little bit. There. There's no drainage, no deviated septum, no obstruction there. Okay, great. So now you can go ahead and come down. All right, so now what I'm going to go ahead and do is I'm going to have you to hold one nostril and breathe in and out. Okay, and do the other nostril. All right, so bilateral patency is noted. So next what I'm going to have you do is I'm going to have you to close your eyes. And I'm going to have you to sniff something. All right, let me know what that is, what that scent is.
Rose.
Okay, you may open. Cranial nerve number 1 is intact. So next I'm going to move on to your lips. Your lips are pink and moist. I'm going to go ahead and get you to open up for me. Okay. And your tongue is pink and moist. The mucosal membrane is moist. All right, smile for me. All right. And your teeth are white. Gums are pink. All right, I'm gonna get you to open up one more time for me and stick your tongue out and say ah. All right, posterior pharyngeal is intact and pink and moist. And uvula is midline. Okay, you can go ahead. Cranial nerve number 9 is intact. All right, so I'm going to go ahead and get you to swallow. Okay, cranial nerve number 10 is intact. So next thing I need you to do is I need you to repeat 3 words for me. Light, tight, dynamite.
Light, tight, dynamite.
Okay, and cranial nerve number 12 is intact. So the next thing I need you to do, I need you to go ahead and close your eyes. And I'm going to place something on you. I want you to tell me where I placed it, okay?
Forehead, cheek, chin.
Okay, and now you can open. And now I want you to clench your teeth together, and I'm going to try to open your mouth, okay? Don't let me open it. Okay, cranial nerve number 5 is intact. So next, we will go ahead and listen to your breath sounds. So I'll go ahead and get you to stand up for me. Okay, so looking at you, your AP diameter is less than your transverse diameter. It is in a cone shape. I don't see any signs of lordosis, scoliosis, or kyphosis. Noted. Okay, so now I'm going to have you to, I'm going to come around you here. And I'm going to put my hands on the small of your back here. And I want you to take in a deep breath for me and exhale. Okay. Posterior lung expansion is bilateral. Now I'm going to put my hands on your on the top of your back here, and each time my hand is on your back, I want you to say 99.
99, 99, 99, 99, 99.
Great. tactile firmness is noted. All right, so now I'm going to go ahead and listen to your lung sounds with my diaphragm. Get you to turn around here. Okay. Left upper lobe, right upper lobe, right upper lobe, left upper lobe, left lower lobe, right lower lobe, right lower lobe, left lower lobe. I'll get you to raise up just a little bit here. Left upper lobe, left lower lobe, right upper lobe, right middle lobe, right lower lobe. All right, so now I'm going to have you to turn around here. And just, yep, there we go. And now I'm going to do the front portion. Right upper lobe, left upper lobe, left upper lobe, right upper lobe, right middle lobe, left lower lobe, left lower lobe, right lower lobe, right upper lobe, right middle lobe, right lower lobe, left upper lobe, left lower lobe. Okay, normal breath sounds are heard. All right, so now we can go ahead and have you to sit down. And we're going to next do your cardiovascular assessment. Okay, so I would inspect the jugular vein. And if I get you to turn that way there, okay, the jugular vein is flat. Okay, and turn this way, turn the other way. Jugular vein, yes, is flat. And yeah, go. And next I will go ahead and check the carotid artery. So you can say, yep. 2+. Do the same thing on this side. Carotid artery is 2+. If I had a middle-aged person, I would take develop my stethoscope and listen for a bruit. But since he's not middle-aged, then I don't have to do that. And so the next thing I would do is go ahead and listen to your heart sounds. And I'm going to listen with both my diaphragm side and my bell side. Start with my diaphragm side. Second intercostal space, aortic, right. Second intercostal space left, pulmonic. Third intercostal space, Erb's Point. Fourth intercostal space, tricuspid. Fifth intercostal space, mitral. Okay, I'm going to do the bell side. Second intercostal space, right, aortic. Second intercostal space, left, pulmonic. Third intercostal space, Erb's Point. Fourth intercostal space, tricuspid. Fifth intercostal space, mitral. This is where I will go ahead and get the apical pulse. Normal heart sounds noted. Okay, so next what we'll do is we'll go ahead and have you to put your hands on your thighs here, and I want you to go as fast as you can back and forth with your hands. Okay, so rapid movement is noted, and then I'm going to have you to close your eyes, and then I'm going to go ahead and tap your hand, and I want you to tell me how many times I tap.
1, 2, 1.
Okay, I'm going to do the other side.
1, 2, 1.
Okay, so 2-point discriminant is intact. Okay, and so now while I have you here, I'm going to go ahead and just get your pulse. Okay, pulse is 2 plus. All right, and now I'm going to have you to stand up one more time. Okay, or if you can, let me see, if you can sit and just have your feet on the floor, can you do that? Okay. All right, so now I'm checking for the pedal pulse, pedal dorsalis pulse. Pedal dorsalis pulse is palpable. All right, so now what we can do is I'll go ahead and have you lay down here. Let's see if I can. All right.
Here.
Yeah, that's fine. It doesn't matter. All right, so now I'm going to assess your bowel sounds and take a look at your abdominal area. Okay, so your abdominal area. Your abdominal area is flat. Your skin there is appropriate for ethnicity. I'm going to go ahead and auscultate the bowel sounds, and you let me know if you feel any tenderness or anything, okay? All right, I'm going to assess with my bell for any bruit up here. Okay, I don't hear any bruit. So I'm going to start in the lower right quadrant. Upper right quadrant. Upper left quadrant. Lower left quadrant. Normal bowel sounds were heard in all 4 quadrants. Okay, now I'm going to go ahead and palpate your abdomen. You let me know if you feel any tenderness. Anything?
No.
lower right quadrant, upper right quadrant, upper left quadrant, lower left quadrant. No masses, no tenderness, no rigidity, no guarding, noted. All right, so next I'm going to go ahead and just assess your musculoskeletal. I'm going to start with your knees. I am going to go ahead and just palpate and inspect. Okay, your knees are bilateral. The contour in both knees are symmetric and normal. Okay, ankles. Okay, let me know if you feel any pain there. Okay, now I'm going to go ahead and have you to flex your foot, both feet. There you go. All right, and can you put your feet down? Okay, and then can you turn them inward? Okay, and can you turn them outward? Okay, range of motion of your ankles are noted. Okay, now I'm gonna go ahead and have you to, I'm gonna put some weight on you with my elbows. I want you to I want you to lift your legs up a little bit and don't let me try to push them down. So lift your legs up, both legs. All right, now, don't let me push them down. All right, now, you can go ahead and relax. Muscle strength in the lower extremities are there. All right, I'm gonna go ahead and have you to sit up. Turn and face this way. Okay, I'm gonna go ahead and have you to put one leg out. Okay, and then put it down. Next leg. All right, put it down. All right, and range of motion and knees are intact and normal. So next I'm gonna go ahead and have you to raise your hands up. Okay, raise them out. Okay, shoulders, range of motion is intact. Okay, bring them forward. Okay, now for your hands, I want you to do like this. Okay, make a fist. Okay, and now I'm gonna have you to make an elbow, like an L, there. And now I want you to let me, don't let me pull your hands. Don't let me push. All right, muscle strength in the upper extremities are noted. All right, and go ahead and have you do like this. All right, and so your wrist range of motion is noted and intact. Okay, and that should conclude my head to toe assessment. Do you have any questions?
No.
Okay, are you, is there anything that I can do to make you any more comfortable?
No, I'm fine.
Okay, and just want to reassess your pain, make sure that you still are not in any pain.
0.
Okay, well, I thank you for your time and your patience, and this will conclude my video. I will go ahead and perform hand hygiene and exit out the room. Thank you.